Hello, my name is Giselle Salazar, and for my infomercial topic, I will be talking about heroin. What is heroin? Heroin is a narcotic opioid type of drug classified as Schedule 1. It is commonly used for abuse. According to the National Survey on Drug Use and Health, in 2016 about 948,000 Americans reported using heroin. This drug is not approved for any clinical use in the United States and is one of the most abused illegal drugs in the world. Common names for heroin are horse, big H, smack, and hell dust. It is made from morphine, a natural substance extracted of opium poppy plants grown in Southeast and Southwest Asia, Mexico, and Colombia. Heroin is moved in illegally to the United States in hidden private and commercial vehicles. Pure heroin is a white powder, but users may combine with other substances like sugar, caffeine, powdered milk, and many more, causing the color to change as per rose gray, brown, and black. Black heroin is known as black tar heroin. Heroin has a bitter taste. History of heroin. In 1874, it was first produced from morphine and was marketed by a German pharmaceutical company of Friedrich Bayer. From 1898 through 1910, the drug was marketed as a non-addictive and it was used as cough suppressant. The drug grew very popular until the U.S. government restricted the use through the Harrison Narcotic Act in 1914, and then it was made illegal in 1924 by the Heroin Act. How can heroin be used? This drug can be injected with a syringe in the vein, smoked, sniffed, or inhaled, snorted as a powder. When the drug is injected or smoked, it is immediately introduced to the bloodstream and leads to an instant rush of euphoria pleasure, which is a state where the user has a feeling of well-being, happiness, and confidence that can last up to 3 to 5 hours. The drug also causes a relaxation sensation. How long does heroin stay in the body system? A half-life of about 3 to 8 minutes. Within 3 minutes, a single dose will begin to break down to a 50%. The peak effects will begin to happen and will last up to 2 hours, and then it will control down in about 5 hours. Heroin will begin to clear up from the bloodstream within 8 to 10 hours. The effectiveness of the drug and how long it lasts in the system and for it to be eliminated depends on the user's height, weight, age, metabolism rate, the amount of doses consumed, and body fat. Effects of heroin. Short-term effects. Rush or euphoric pleasure, dry mouth, warm, flushing of the skin, slow and depressed breathing, nauseous and vomiting, clouded mental functioning, pain in weak muscles and bones, severe itching, heavy feelings in arms and legs, slow heart rate. Long-term effects of heroin. Addiction physically and psychologically. Veins get collapsed by those who inject the drug. Kidney and liver disease. Lung complications such as pneumonia, tuberculosis, insomnia. Mucous membranes are damaged for people who sniff the drug. And also constipation and stomach cramps. Risks and consequences of heroin. Some risks are infectious diseases. People who use needles to inject heroin are at risk of developing and contracting transmittable diseases like hepatitis C and HIV and AIDS, heart infection, valves, and blood vessels, miscarriage, birth defects, and low birth weight, premature birth, and neonatal abstinence syndrome, also known as NAS, overdose, and coma. Some consequences are social problems, financial problems, dependence on heroin, death from overdose or disease. More than 115,000 Americans have died from overdose of heroin from 1999 to 2018. School or work problems, depression, aggression, and confusion. Withdrawal of heroin. Symptoms of sign of withdrawal. In 4 hours of withdrawal, addicts will begin to crave for a consumption of more drug and will experience headaches and anxiety. In 8 hours, they will have runny nose, tears, yawn, and users will begin to sweat, also known as perspiration. Then at 12 hours, addicts will have pupil dilation, goosebumps, loss of appetite, pain in muscles, hot and cold flashes. Then, between 18 to 24 hours, they will experience fever, insomnia, blood pressure begins to raise, and nausea. And lastly, between 26 to 36 hours, they will have diarrhea, vomiting, foot kicking, also known as kicking the habit. This is the conclusion of my presentation. Thank you very much for watching.